India is the world's largest democracy with healthcare indicators lagging behind some of the other countries in the region, and the growing disease burden of non communicable diseases being a major cause of concern. The ongoing pandemic has put the spotlight on the quality of healthcare services and advances in medical technology. In fact, COVID 19 has altered the means of delivering healthcare, for that matter, accessing it. Advancement in science and technology has made remote monitoring and digital healthcare a possibility. The use of artificial intelligence using AR or VR and wearable technology in healthcare is now finally a reality. Healthcare transformation has been accelerated with technology infused changes. Skills for healthcare professionals also need to be today constantly updated. It has thus become imperative for medical professionals in India to keep abreast of the latest techniques and technologies in the domain. Medtronic, which is the world's leading medical technology services and solutions company, has been at the forefront of training and education of healthcare professionals. The company recently organized India's Next Sushruta, INS, in partnership with DocPlexus. India's Next Sushruta, or INS, as it's more commonly known, is a case study competition targeted towards postgraduates and super specialty students in the field of surgery. It is a one of a kind academia contest in the medical technology space in India. We are here today to discuss the importance of training and education in healthcare for doctors, particularly in the medtech sector, and the need to evolve with time. Today we have with us the winner of India's Next Sushruta, Dr. Usha. She's the MCH for Surgical Oncology at Kidwai Memorial Institute of Oncology at Bangalore. Dr. Souvik Paul, DNB Surgical Gastroenterology from BLK Super Speciality Hospital, New Delhi. We also have Dr. Nitesh Kumar, MS Urology from Osmania Medical College, Hyderabad. He's the second runner-up for the INS. And Dr. Ravi Arjunan, Head of Department of Surgical Oncology, Kidwai Memorial Hospital, Bangalore. And finally, Mr. Madan Krishnan, Vice President and Managing Director of Medtronic India. Let's open this discussion by asking my first question to Dr. Usha. Congratulations again on winning INS. How was this experience of this competition?
So India's Next Sushruta was very special because it was very innovative, and it did recognize every candidate not just by their qualification or by their degree or the book knowledge that we had, but it actually recognized the original work that every candidate has contributed, which has practical implication. So this really means a great leap to our passion as young budding surgeons when our actual work gets recognized from the esteemed and highly respectful jury members we had on the forum of India's Next Sushruta on the grand finale. And this event has given us a great sense of motivation to keep going ahead and to do better work to the best of my abilities. Thank you, Medtronic, for the opportunity to participate and also to be a part of such an amazing event. Thank you very much.
Thank you. Dr. Arjunan, you're of course the head of the department where Dr. is practicing, right? I mean, so most of the medtech advancements have happened in the last 20 years. And I mean, there's obviously a constant need to upskill for doctors. So how do you think programs like INS add value here?
Yeah, the 3 years of postgraduate training helps the doctors on the mode of treatment that has to be given in any particular situation. And this is further augmented during the super specialty course, during which they learn the concepts of treatment, which is evidence-based, including the latest updated treatment for any disease. Medical technology has evolved over the last 3 decades, and at present, we have latest technology and infrastructure available in all the specialties. In addition to learning the basic skills during the postgraduate training, it is necessary for the doctors to update their skills and knowledge by attending regularly to conferences and hands-on training workshops, during which time they have to improve their skills in the latest medical technological infrastructure that are available. The programs like India's Next Sushruta, conducted by Medtronic, is an additional boost to the budding surgeons, which improves their competitive spirit and provides them with the encouragement and opportunity to go for further training in a reputed institution of their choice.
Dr. Paul, again, thanks for joining in the show today. You were the second runners-up in INS. What are your key takeaways from the program, and how do you feel it's going to add value to your career?
First of all, thank you that you have participated in this panel discussion. Now, key takeaways, first of all, that even before this COVID era, we couldn't even think of such a national level competition in a virtual mode. So that is one very important key takeaway, that such national level competition can be made possible even without being personal interaction by this virtual mode. And second of all, that one takeaway that we can see in the grand finale, there are multiple good papers that has been coming up with the presentation, and before that also there are very much good abstract submissions as the judged by respected jury members. But somehow I feel that we as Indians do lot of works and surgeries and all over the year, but we document ourselves to a little lesser degree compared to the other Western countries. So we need to some sort of do a research, maybe a simple research, which is a basic primary. After that, we can advance to other research technologies could be implemented, and then come to some conclusions that Arjunan sir has said that randomized control trials, meta-analysis, all these things can be done from our Indian context, so that we can make our India to be proud and to be recognizable to others. So that, and with that, for this we need some technologies. The technologies in the form of that doing work and also doing publishing our data. So that is quite important to me.
Mr. Krishnan, bringing in you here as a global leader in medical technology, what is Medtronic doing to empower doctors to adopt the latest in global technologies in India?
Thank you, Rudra. First of all, let me also congratulate Dr. Usha H, head of the department, Professor Dr. Ravi Arjunan. So I think Medtronic, right from the inception of Medtronic, where our founder invented the first battery-powered pacemaker. For the last 7 odd decades, we have always been in the forefront of innovation and educating and empowering clinicians and surgeons across the world. And in India also, over the last 4 decades, our focus has been to increase clinical capability and the latest innovative products into the market to serve patients and population in India, just like in other countries. We believe that no company, Medtronic, cannot do this alone. So collaboration is key in our approach. We believe that we can only take healthcare further together if you collaborate with esteemed, clinicians, providers, government, and every player involved in the spectrum of healthcare delivery. We're focused in ensuring that we provide access to technology and the right training, both practical, theoretical training required to use our products in a safe manner. We believe that technology will allow us to leapfrog in the care continuum, and the technology will allow us to get superior outcomes. But nothing is possible without trained clinicians and surgeons. And this competition to identify the best of the best in India is in that direction, identifying India's next Sushruta. We also are running significant number of programs from our training center in Mumbai and other training collaboration centers across India to ensure that we identify needs in the curriculum and training and educational continuum. And we continue to equip surgeons, implanters to improve their skill so that together we move towards better outcome for patients. In a country like India, we need both superior efficient outcome and we also need greater supply of qualified medical professionals, across the spectrum, right from allied healthcare professional to the most advanced capabilities among surgeons and implanters. I give one example of a training which has a much broader also social context that we are creating in India, which a program called Shruti. This is a program that Medtronic has been supporting over the last few years, where we train village ASHA workers, village level ASHA workers to go into underserved communities to detect, identify, and help diagnose conditions affecting the ear. More than half of our deafness in India can be actually prevented with the right treatment at the right time. So we are combining, we are training these ASHA workers, giving them respectable employment, giving them skills to be independent, and giving them technology in their hands, which is a otoscope connected to a Android device where the data is uploaded into the cloud, where a capable surgeon can look at these images and diagnose the condition, and the right treatment is given. So this is one example of how training and technology come together. And when we talked about India's next Sushruta, the idea was to create awareness among the need for excellence in education and practice of medicine. As one of the winners mentioned, clinical evidence is also key for us.
Congratulations on your win. Do you think programs like INS can add value over and above the academic learnings for a doctor? What would be your most important learning from participation in the INS?
Yes, it has certainly done and will add more to the learning. The thing that it helped me to interact with our fellow mates, it creates a healthy environment, a competition, healthy competition, and you can learn from others' mistakes, and also you can imbibe the good things what others have. Also, the mentors, you have great deal of to learn from them. They help us a lot, and the ability of the programs like INS to connect the surgeons of all over the India and to combine within a program, interact, and get a healthy competition is a very good thing. And with all and the awards, the rewards of this is also amazing. The most important thing that I learned from the program was that to compete with a free mind and give your best without worrying about the results. Thing was, as I have passed my yeah, degree, I have started my professional career, I was busy in my work, so I had less time, but I prepared the contents for the final event in a bits. You can say a small baby steps, but each step you take towards success is a right way. And if you go on heading in that direction, you'll definitely reach there. Maybe a delay may be there if you are not that fast, but definitely will reach there.
So all great points, right? I mean, and clearly the last few months have shown that healthcare has to be a much larger focus area for us as a country, globally, of course, but also for us as a country. This year's budget is a recognition of the fact that the government feels the same. There has been larger allocation on healthcare spending, focus in this area, but just spending is clearly not enough. You need a lot more, things going on in terms of regulation protections for our medical professionals. And of course, support from industries such as Medtronic, right? I mean, that is key to building this larger ecosystem. My next question, and this is to Dr. Arjunan, right? I mean, how would you describe the evolution of digital healthcare? Especially keeping the recent pandemic in the background, telemedicine, etc. What is that journey, and what is the culmination of that journey that has sort of happened in the last few months?
Yeah. So digital healthcare has evolved over the last 2 decades all over the world. And it is indeed heartening to note that even in India, we are not very far behind in using the digital healthcare. In many of the hospitals, we have started with digital healthcare. In fact, our own Kidwai Institute, we have started digitizing all the records, and probably in another 3 to 4 months, we will be going completely paperless. So that way, all over the country, digitization is happening. It's very heartening to note that. And three most popular forms of digital healthcare are the telemedicine, then wearable technologies, and virtual reality. So the use of digital health platforms has been accelerated worldwide during this COVID-19 pandemic. Especially the government, it has helped by tracking the smartphone location of those who have logged in with the, say, for example, the Arogya Setu. It has been found to be very helpful for tracking those public who have been exposed to COVID-19, tracking their location and helping them to isolate and quarantine them. So that way this digitization has helped. And at present, the only disadvantage is that there is a digital divide compared to urban and rural population. Whereas in the urban population, there is a very good connectivity available, broadband, as well as other internet 4G facilities and all. Whereas the same is not true with the rural population. The network facility is less, broadband facility is less, and the population as such is not so much exposed to the digital healthcare. So that there is a digital health divide between the rural and urban population, which needs to be, that bridge needs to be narrowed in the near future. That will be my opinion. Thank you.
Interesting. So one of the thoughts earlier in a different conversation was mentioned that a government sort of create a national highway sort of information or an exchange where this can be done at a public sector level rather than individual companies investing themselves. Great. Mr. Krishnan, coming to you and a very important subject of upskilling, right? I mean, how can we have a better ecosystem which helps in upskilling medical experts in India? And I'm sure a lot of different parts of the entire chain have to really come together to make that happen.
I think again, collaboration is key. Prioritization and collaboration is key. And when I talk to the top policy makers, Dr. V.K. Paul or the other experts at Niti Aayog or the Ministry of Health, there is a commitment to develop capability, and there is an awareness that we both have numbers. Now you don't have the adequate numbers of trained professionals, and the quality and the skills have also got to be built. Dr. Arjunan very nicely talked about the divide between urban and rural. Yeah. I feel that just like in technology, how technology will allow us to leapfrog in the care continuum, and in capability build also, I believe that technology will be the bridge. Yes. Because digital technology will be a great asset for us to bridge rural, urban, and across the country. And there's a lot of focus.
Yeah, yes, there is a lot of scope for that.
Yeah, exactly. And I'm happy to hear, Dr. Arjunan, you talk about digitizing of all records in a hospital, Kidwai Center, and which is a great example also, correct? So you get access to record and people can access it from anywhere also, correct?
True. Yeah, that's right.
So I think digital divide can be healed through digital in that sense.
Thank you. Thank you, Mr. Krishnan. Clearly, the digitization of healthcare is the leapfrog that is sort of solving the scaling challenge that has inherently been there, right? I mean, how do you reach healthcare to the more remote, smaller parts of the country? How do you do it in a cost-efficient manner? This is the real solution out there. So Dr. Usha, coming to you, and this is the same question that I'm also going to ask to Dr. Souvik after that. What would be your message to the young budding surgeons in the country around upskilling and improving access to healthcare? I mean, most young medical professionals just getting out of college have a lot of these questions about how do I keep upgrading my skills? Things are changing so fast. How do I, and also, going deeper into the country and practicing healthcare there? That's always been sort of this big question. I know a lot of friends of mine who are doctors sort of deal with that challenge, right? So how would you sort of address that? What would be your response be?
So all young budding surgeons must understand that they are very, very valuable to this healthcare system, because we must understand that all of us are doctors, but we are the doctors who can also operate. So surgeons are very different when it comes to the medical fraternity, where physicians can only practice medicine, but surgeons are the ones who can do both, practice medicine at the same time, can also operate. So I have a few advices for these future young budding surgeons, is that they should stay hungry and keep evolving their skills and restless in the endless pursuit of excellence. They should understand that we are all works in progress, and nobody's achieved their greatest heights until you go and pursue your excellence, and there is no end to learning in surgery. And these surgeons should also have in mind that they need to pay it forward. So the trend should be that you should remember that you have reached this level because there was someone who helped you and mentored and shared freely of their knowledge, and you must repair their favors that they have done to you. And I would like to do this to my head of department, who's trained us and nurtured us over the 3 years of training in surgical oncology at Kidwai. Thank you, sir. And everybody should develop a niche, a passion towards an area of specialization, and should become a master of a narrow field. So I think specialization is what is lacking in India, because we don't have many specializations who specialist doctors who are available at the doorstep of every patient who requires it. So anything is required for these patients, they need to move to a tertiary care center, which may not be accessible to every individual in this country. And everybody should have in mind that whenever they are working in a particular place, or if they are a part of a program, they need to leave they need to work in such a way that they should make their work measurable in some way uh, before they leave the particular place. So they should make their work matter. And they should also have in mind that it is the training is not the end of it. They should be actively participating in the meetings and the trainings throughout their career, and try to learn one new skill or at least one new procedure each year. And as T.S. Eliot said, that only those who risk going too far will actually possibly know how far one can go. So stretch yourself beyond your limits. So this is my advice to all the young budding surgeons.
I think this is very important messages for the community, for young professionals entering this space today. I hope this is highlighted. Dr. Paul, your views on the same question, really. Your message to young budding surgeons in the country around upskilling and improving access to healthcare.
I completely agree with Dr. Usha that rightly pointed out all the 3 points that are very important for the surgical practice and even medical practice and everywhere. So along with that, I would add something that in our medical services, there is a very long, very much things to be taught or to be taken into consideration in the very short period of time. But everything we could not be achieved with a short period. So we need something, some technologies to learn a lot within a very short time, because we could not go into some one place to another place. That will take some time. So in that case, telemedicine is very important. In specifically, I know that in super specialty, in our subject also, and some other streams also, there are telemedicine classes weekly. So these things are very important. For suppose a student is sitting in Chennai, they can learn what is happening in the Delhi. So these things are very much important, which can be acquired and must be attended to improving your access to the healthcare. And second of all, that there are different apps, all guideline apps. So you can update yourself with that apps, like up to date, like NCCN guidelines, all these things. With these things, you can up to date match with the other things, that what Americans, what Indians comparatively they are doing. And so that is one important, that your access to the healthcare is to be actually judged or to be done by these comparative studies.
Thank you. Thanks a lot. I think important points. Of course, telemedicine is significant in helping spreading information much faster than what could happen previously. One of the things, one of the thoughts that I've come across is a sort of a national bank of sorts of all this experience where everybody can leverage from. Not only a national sort of, so digitization of records is going to be important as a first step to making sure that data of patients is available across everywhere. So you're a doctor, you're looking at somebody for the first time, you have the entire history right there in front of you because there's this national register, right? Then this is really the last question of the day, right? I mean, what would be your message to the young budding surgeons in the country around upskilling and improving access to healthcare?
The thing is, you can frame this question in a two-part. I would like to answer the first. As a young budding surgeons of the country, you need to focus both on your learning and skill and also the knowledge. Learning will improve your both skills and knowledge. Both are important. Knowledge alone cannot do anything, and skill alone cannot do anything. These both things are complementary. As someone said, it's an old saying that learning what to operate is a matter of hours or months, but learning what not to operate is a pearl of wisdom. You need to reach that stage, and everything is unique. Every case is unique, and you have to always keep in mind the dictum, of primum non nocere, first do no harm. You should always leave your ego behind and think about the well-being of the patient. Patients comes first. There will be good days in your life, there will be bad days, there will be days when you cannot perform what you thought, there will be days where you will escape from your blunders only, but just keep going, keep learning, and grow together. There will now the second part, what you can contribute to the healthcare is like the technology is advancing. You can advance also with the technology. You can reach out to many people. Now you can see just the programs like INS has reached out to all surgeons all over India, has imbibed us that we can do such thing of a program like that. And this technology will do a lot of great. It's changing definitely day by day, and the healthcare industry will be refined. Nowadays you will be see the prescriptions online. You can keep the patient's data, all everything online. Earlier when we see a logbook or a discharge book of a big institute, you would say that, oh great, that's a protocol, they are maintaining all the records, everything is there. But now you have everything digital. Just you click on the date, click on the patient's name, just to keep the mobile number, everything will come. Even a doctor who is sitting is in a different city or a country can access your health records if he has access to the app. So these things are changing. You can help, you can reconnect, you can take advice of everything. Now suppose even if you're in the middle of a case, you need advice, you can directly reconnect with other. This is a guidance. So this, with technology and advancement, you need to advance yourself. Do not lag behind. Go ahead, go forward, and be victorious.
Thank you. So these are great thoughts, and I think we are really heading towards that. I mean, the past few months have really increased the pace of that process. A big thanks to all our panelists. This was really my last question. Very strong and powerful points have come out of this conversation today. Today's discussion, of course, made it amply clear that the latest advancements in medical technology space, and of course, we need skilled healthcare professionals who are abreast of these latest developments. To become a hub of world-class healthcare, all stakeholders and the entire ecosystem needs to come together to constantly offer skilling and training opportunities to medical professionals. With this thought, we would like to end today's proceedings. Thank you all for joining our discussion today.